All right, we have a quorum. Let's go ahead and start. Today is March 10th. It's Tuesday. We are here for the City Council work session. We're in the Boards and Commissions room. It's 9:08, and we have a quorum present, and we'll go ahead and begin. We're going to begin today with two briefings. The third briefing we have to have this morning as well. We're going to begin with a virus briefing. We're going to go then to the homelessness issue. We'll have a briefing on the Minority Women-Owned Business Enterprise Procurement Program at the airport. We have someone in from out of town to do that, who then needs to be with us for the executive session on that issue. Hopefully we can get through all three of these things before we break for lunch, and we can then go into the executive session. Let's start there and see how we're going. Let's begin with a briefing on the virus.
Beautiful. Good morning, Mayor, Council, Mr. City Manager. Dr. Mark Escott, Interim Health Authority for Austin Public Health, here with Stephanie Hayden. We're going to give you a brief update on our COVID-19 situation. Let's see here. As you all have seen in the media, substantial increases continue with a worldwide count yesterday of over 113,000 cases. Again, the vast majority of cases are still in China. However, Italy is of particular concern due to widespread and sustained person-to-person activity with more than 9,000 cases and 463 deaths. You may have seen yesterday the country of Italy is under quarantine and will be closed largely until April the 3rd. This is an effort to break that chain of transmission. And we expect to see that happening in other European countries and other countries around the world. I've listed a few countries where there is substantial person-to-person spread. This is not an exhaustive list of countries with evidence of person-to-person spread. There's a full list available on the WHO website, but that number is much larger than this. In the United States, the situation has substantially worsened since Friday. A total of 607 cases now with 22 deaths. Actually, it's 26 as of this morning, with 13 confirmed cases in Texas and evidence of person-to-person spread in Washington, California, and New York. Sorry, I lost a slide there. Of the cases in Texas, there are 6 in Harris County, 6 in Fort Bend County, 1 in Collin County. All of these in Texas so far are not person-to-person spread. They're all travel-related with no evidence of person-to-person spread in the state of Texas. For our local Austin-Travis County situation, we are still at phase 2. We have sent off a number of tests for COVID-19. All of those tests so far have been negative. As of Thursday of last week, the lab was online in the city of Austin through the Texas Department of State Health Services. This adds to the other state labs in El Paso, Dallas, Tarrant County, Houston, Lubbock, and as of yesterday, Quest Diagnostics went online with a private lab, and we're expecting additional labs to go online as well. We have heard from Quest that their number of tests exceeded their capacity already, and they are not accepting additional ones at this stage. But again, we expect that capacity to increase. The state lab in Austin has asked for an increase in capacity. Right now, that is limited to 10 to 25 tests a day. So we've been facing a lot of questions about mass gatherings and why canceling South by Southwest made the most sense at this stage. And this is a graph. This is adapted from the CDC, but it illustrates the point of why now. The peak on the left is what happens when we don't have aggressive control measures, when we start to see this person-to-person spread in the United States or in our community. The one on the right-hand side is with that control measures. The dotted line that you see is the capacity of our healthcare system. So as an example from this outbreak, what you saw in Wuhan City was the graph on the left. Because they had a massive increase in cases very quickly, it far exceeded the capacity of the healthcare system to manage those cases. The case fatality rate for Wuhan City was 17.3% in that from January 1 to January 10. If we look at after control measures in the rest of China, that case fatality rate dropped to 0.7%. So substantial differences based upon how we manage that outbreak. What we call the area under the curve, the total number of people who get it, may not be different between the two. But if we can control that process, we don't exceed the capacity of the healthcare system, and people will do much better. So as a result of the disaster declaration, we've prohibited mass gatherings over 2,500 people until they can submit and we approve a mitigation plan to ensure that event is as safe as possible. Now, some have asked, what about local events? What about high school events? What about things that just draw crowds from locally or Texas? That's a completely different risk profile, again, because we don't have spread locally. We don't have spread in Texas. Again, we'll be reviewing those. We'll be approving those and providing further mitigation advice. For those gatherings under 2,500 people, we're still going to provide recommendations. We're still going to be available for consultation with folks so that we can guide them, even if it's a wedding reception or smaller event, so that they can do what they can to ensure the safety. I will mention there are a number of private consultants who are available to help individuals, help companies do some risk assessment for events like this. So those are available. Recommending folks look for those if they want to consult a private firm to help them in the planning process. So a quick update on our response activities. Our Department Operations Center has been activated for more than a month now. We have ongoing phone calls from our staff 24 hours a day. They're receiving calls from clinics and from hospitals and triaging those, identifying those who need to be tested, and then coordinating testing. We have triage going on from the EMS side for folks who call 911 that involves consultation with a physician to review and to triage as well. Calls for the general public are coming in through 311. We have scripting available for them. If a clinician calls through 311, that gets moved over to APH to manage. Again, our team has been actively involved in collecting swabs, either directly testing people or collecting them from hospitals or clinics that may have tested. In addition to that, we're ramping up social services support for those who are under monitoring to ensure that they have what they need to be compliant with that quarantine order. We've also added information technology, GIS mapping service to help us anticipate future needs and the utility of mapping, both publicly facing and internally facing mapping software to help us as we prepare and continue to respond to this event. The Emergency Operations Center is still at partial activation. That includes the Joint Information Services. We have daily reporting through the Capital Area of Texas Regional Advisory Council. So there's a network of all of our regions. We have a listing of every single hospital, every single freestanding emergency department in our region. And we know how many beds they have. We know how many isolation beds they have. We know how many ICU beds they have. So now we're in the process of getting that daily report so we know when we're how good we are and when we start to face concern where we need to increase capacity. In addition to that, we've got our Capital Area Medical Operations Command working on contingency planning for surge events. How can we increase capacity if we need to increase capacity? And also we've asked our hospital systems to look at opportunities to increase their telehealth service capabilities. As we know, the vast majority of people who will get this infection have a mild illness. They don't need to be in the hospital. They probably don't ever need to see a hospital. This is what we do with flu. If you remember our messaging from several months ago, as flu peaked and hospital beds went down, the messaging was stay home. If you have telehealth capabilities, contact your doctor via telehealth. They may give you some Tamiflu or another antiviral medication. If you get worse, call an ambulance or go to the hospital. But the vast majority of people for flu don't need a hospital. The vast majority of people who will get COVID-19 do not need a hospital either. Again, our messaging for the public continues. We are working on a series of public health orders to strengthen the public messaging as well as to protect those most vulnerable populations, including those at assisted living facilities, nursing homes, and rehab hospitals. We expect to have those drafted in the next couple of days and issued. We're working closely with the law department as well as our environmental health services division to craft those and get those finalized. And finally, we have our website, which is consistently updated with frequently asked questions, responses to those, as well as links for people who want to hold mass gatherings for schools, for clinicians, and for the general public. Again, this is the website with reliable and up-to-date information, and I'd be happy to take questions.
Okay, I'm going to begin. Colleagues know that on Thursday, there's an action item on our agenda for this. The county judge and I both declared a local disaster so that the city and the county could weigh in and start directing some activity, start establishing some standards. Included in that was, as you know, canceling South by. Also putting the order in place that says that any event over 2,500 people can't take place unless and until they've worked with our public health officer and director and department. But that only lasts for 7 days, which means that on Thursday it comes to us as a dais to decide whether or not to keep any or all of that in effect. So this is coming to all of you here, and it's with the Commissioner's Court today. Some questions. First, I want to say that I'm really proud and once again just so impressed with watching the city and the county and the region's emergency operation command stand up. 75 people, all having jobs to do and protocols to follow. It's a machine that steps into these kinds of situations, and it's reassuring to see. The comments that we've made publicly, I think, can be repeated really quickly. This is with this virus. Obviously, there's been a briefing of this council a couple weeks back. The conversations are ongoing, are daily conversations. The Emergency Operation Command is on a call daily, at least once a day. Portions of it are on the phone throughout the day, constantly doing a risk assessment. I commend you both for convening that advisory panel that has representatives of the 3 large health providers in our region, as well as the top infectious disease specialists from Dell Medical School, our top public health professionals in Central Texas to advise. And please thank them again for their work. I know it's taken a lot of their time over the last week as they've been meeting constantly. The decision was made on Friday to recommend, and then the judge and I both implemented that order to cancel South by. I get asked the question, on Tuesday you had a press conference and you suggested that the risk assessment indicated we shouldn't shut it down, and then on Friday it was shut down. What happened between Tuesday and Friday? I would remind everybody that at the press conference at Tuesday, we went through the factors for the risk assessment at that point. We also said that it was an ongoing conversation and the decision and the advice could change at any point in time, and when it did, we would act immediately. Would you explain what it was that happened? What was the change?
Sure, Mayor. After that first meeting with the advisory panel, there was concern. There was concern about risk. The question was, could that risk be mitigated or not? Part of that was hinging on some details regarding the events. Where were people coming from? What do the venues look like? How long do we expect people to be together, face to face? And the group needed to talk to South by Southwest. They needed more details. We need to discuss mitigation options which may minimize that risk and still allow us to go forward. In addition to that, there was deliberation about the health impact of canceling, because we know if there's an economic consequence, then businesses could close, people could lose their jobs, they could lose health insurance. So these are all things that had to be weighed before we make a decision of this magnitude. While we were doing that, the situation continued to grow across the United States. We had evidence of increasing person-to-person spread in multiple communities, and that led to also the anticipation that the situation would continue to get worse in the days leading up to South by Southwest. Ultimately, through the discussions with the panel and with South by Southwest, we could not identify a safe path forward that would minimize the risk enough to the community. Let me explain a little bit more why that's a particular concern. Bringing people here together, the potential of having or developing an outbreak locally that then goes to other communities. Part of our ability to surge for events like this is based upon partnerships with other cities in Texas. If Austin faces a struggle, we have an event, we have a lot of people that get sick, we call on Houston and Dallas and San Antonio and other jurisdictions to come help us. If they have outbreaks themselves, that redundancy goes away or is lessened substantially. If we have outbreaks across Texas, we can pull in people from other states. But if other states are experiencing outbreaks at the same time, that redundancy is then limited. So events like South by Southwest has the potential to create a ripple effect across communities across the state of Texas and across the United States, and that was certainly a factor that we discussed as well. What's the overall impact on our ability to really protect this community and the potential for larger impact across the U.S.?
And I think you also pointed out at the time that there were, at that point, increasing person-to-person spread of the virus that we were seeing as well.
Correct.
Next question I get asked, I want you to speak to is, okay, so South by Southwest was shut down, but yet we are allowing events to continue in this city. The UT basketball team, continues to play sporting events. We continue to have clubs that are open and restaurants that are open in our city. Why are those things allowed to stay open if we had shut down South by?
Yes, sir, and we've received lots of questions and comments on that. Again, events that are local, events that are anticipated drawing crowds from Texas or other areas that have no evidence of person-to-person spread pose a substantially decreased risk of initiating an outbreak or perpetuating an outbreak, because we don't have any indication that there is disease in the community right now. Again, as the situation evolves, our guidance is going to have to evolve as well. And part of the guidance for the mass gatherings for folks who are wanting to host is, what is your plan to change last minute if the situation changes? If we get evidence in Texas, if we get evidence locally at some stage that we have person-to-person spread in the community, how are you going to message your attendees? How are you going to what options do you have to further mitigate that threat based upon what's happening? So again, that's why we're reviewing each gathering individually to determine if there's a substantial risk or not, and if there is a risk, if we can effectively mitigate it or not.
Okay, so right now we have the general order that says if you're doing an event over 2,500 people, they have to check with you. You've published lists of mitigation measures that activities should follow. That's something that you're continuing to update, even for events fewer than 2,500 people, to be able to follow that. As a city, we've given permits to events. My understanding is our permitting department is reaching out to all events that we have permitted that are not South by Southwest events to lay out what the protocols are for mitigation. And you're working, our health department and code staff are working with all of those entities. Is that correct?
That's correct.
Okay. We recognize that there are a lot of people in our city that are hurting right now because of what we've done with South by. And certainly, depending on what happens with this virus and the indicated action, it could increase or expand. We don't know. But even dealing with what we're dealing with right now, we're encouraging people still. There's not a reason for people not to go out and eat at a restaurant or go to a club. In fact, that's something they could do to help support the local economy at this point. Is that correct?
Absolutely.
All right. And we're all heading out. The Austin Community Foundation has opened up a fund. Stand with Austin is what they're calling their fund. It's taking in gifts from people. As stated on their website, their mission is to provide charitable relief to those that have been most injured with the cancellation of South by Southwest and are least able to weather that injury. And I commend the Austin Community Foundation and the Entrepreneurs Foundation. I think the two of them together are working to set that up. I have a couple questions now that go outside of what our response has been and where we are as a city. If someone has an event that's coming to Austin, they know about a big group and they want to touch base with our city to make sure they're doing everything they can do and that they would be allowed to proceed, and the recommendation would be to allow them to proceed, who do they contact in our city government?
Good morning, Stephanie Hayden, Austin Public Health. They would go through the usual route that they take. So if it is a special event, they would go through the Austin Center for Events. If they are working with the Convention Center or Palmer Events, they would reach out to them as well. If it is a private hotel, we have established contact with them as of yesterday, and so they are familiar with the process. Ultimately, we are asking people to call 311 because our operators are ready to just kind of give general high-level information. The Environmental Health Services Division has established a mailbox if people want to email us as well. So those are the measures in place. What we really cannot emphasize more is that we're wanting this to be a seamless process. The existing process that is in place, Austin Public Health is just going to insert an additional step to the original process. So there's not going to be any changes to the process or procedure that is currently in place to our special events process, but there's just an additional step for mitigation.
Okay, thank you. And what we're recommending as a city and as public health officials is really to take seriously the admonition to wash your hands a lot for a full 20 seconds. The hand sanitizers are good, not as good as washing your hand for 20 seconds, but still better. We're trying to get people to not shake hands as a social greeting. That's a really hard thing to do, especially when someone walks out and holds out their hand and there's an expectation that if you don't take their hand, you're doing something that's wrong. The only way that we create a culture where people will accept that is if we actually start doing that. So a bump or a namaste greeting, really we want people to go through this uncomfortable period of time while we try to re-socialize that as widely as we can. Beyond that, I want to ask you about testing. You know, we read in the newspaper that in some countries right now there are drive-in testing facilities in order to get to a vast number of people. We have a testing facility with a capacity of 10 to 20 people a day, I think you said. A private one that was stand-up that's already at capacity. It seems to me that one of the first places we're going to see our health system stressed are going to be with people that aren't feeling well, that are going to want to get tested to know whether or not they're a danger to others with this virus. Where are we on testing, and is there an expectation that, well, how are some people doing drive-in testings for people and we're not?
That's a great question, Mayor. We have actually done some drive-up testing already. The challenge is we don't have the capacity to support scaling that at this stage on the testing side. We actually have our EMS department, Austin Travis County EMS, developing planning for community drive-up testing as one option to do a large number of tests. You know, I think it's important to understand that at some stage testing mild cases may not be necessary because it's not going to change what we do. At least at this stage, we have no specified treatment plan for this. There's some clinical trials underway using current drugs and novel drugs to manage this, but testing for the purpose of knowing or not knowing, it's important right now to contain it, but once that's breached, the testing may not be as relevant unless people are hospitalized. So why is it important in the hospital to test? Hospital testing has a priority because it tells us, does this person need to be isolated in a relatively rare commodity at some stage, an isolation bed, or can they be in the general population on a regular floor or telemetry bed? We expect that testing capacity will increase. I do want to be able to offer to folks who want to be tested the option of testing. Right now, and at least for the foreseeable future, we're still going to have to triage and prioritize those folks who are hospitalized so we can differentiate those who need the isolation versus those that don't.
Is the testing or any other aspect of the response to this a question of resources that you have? Let me state that differently. If you can think of anything that we could be doing as a city to be keeping the community safer, or to get ready faster, or to be doing anything that requires any measure of additional resources, I assume either the manager will just do it with the emergency and administrative authority he has, or that you'll come back to this council with whatever it is that you need to err on the side of making sure we're ready as we can be to keep people safe. My last set of questions goes to the ones that are most vulnerable in our community. What is the mortality rate right now for people who might be over 70 and contract this virus?
That's a great question, Mayor. We've all seen lots of different figures related to case fatality rate. The indication is right now for those over 80, they're at the highest risk. Some estimates are as high as 20%. As you go down in age, the risk is decreased. 70, 79, maybe closer to 10 to 15%. 60 to 69, closer to 7 to 10%, and then it goes down from there. When we get to the vast majority of people who are getting sick, that number is probably close to 0.2 to 0.4%. So again, this is not Ebola, where everybody gets critically ill and a significant number die. This is not that. It's not as bad as MERS or SARS either. MERS or SARS. But if it gets in the wrong places, it will be impactful. If it gets into nursing homes, assisted living facilities, it could be devastating for those facilities. If it gets into hospitals in an uncontrolled fashion where there's already people suffering from illness or injury, it could be devastating. And that's why we're taking steps right now to secure those facilities, to make sure that we're controlling access, that we're doing some temperature monitoring of individuals entering those high-risk facilities, so that we can take measured steps based upon the actual risk that we have, that we know of, to try to secure those areas and protect those people.
And that was my last question. What are we doing in those? And you've answered that question, those facilities. What about homeless encampments? People that are experiencing homelessness in our city, I would imagine, would also be a population that could be at risk with compromised immune systems, or at least some folks there might be. What are we doing there?
So we're in the process of working with our homeless office. I don't know if Stephanie wants to take that. She's been involved in those discussions.
There are several things that we are finalizing. One, working with our outreach teams as they are going out and having contact. One of the things that's really important for us is to ensure that they have the protections that they need so they don't contract anything themselves. In addition to that, putting together little small kits that we are able to take out to the homeless population. The kits will not include hand sanitizer, but will include hand wipes. And so that's just a little bit of a mitigation that we have to put in place. In addition to that, we are working with the shelters. We've received guidance from the National Alliance to End Homelessness as well as HUD to provide us some additional guidelines to be able to put some measures in place at our emergency shelters, as well as any kind of short-term places where folks are doing transitional type housing. We have increased the list of other facilities that we need to work with as far as substance abuse treatment facilities, as well as boarding homes. So there is a list of vulnerable populations that we are working with and doing some targeted specific outreach with those populations. And then the last thing is the department is working with the Commission on Seniors, and we will be providing a presentation to them, as well as working with the aging area on aging as well.
Thank you. Leslie.
Well, first I want to thank our staff for the nimbleness with which you all came together and the collaboration across all of the departments and within the region. It really has made a huge difference, I think, in people understanding what we're looking at and how we're proceeding. I just had one question specific to the testing kits that if you could address. The one kind of gap that I perceive in the reporting is whether and where there are sufficient testing kits in order to assure us that whether people actually have the virus. What is the, are we on the distribution list for them, and do we have enough, and what's the future of that?
Excellent question. We don't have enough kits. We don't have any, Austin Public Health doesn't have any testing kits. We have the ability to swab individuals and send testing, but the testing kit actually runs the test. And those have to be done at the state lab here in Austin. We're talking to physicians every single day, asking, can I test this person? Can I test this one? Right now we're still having to triage. It would be nice at some point to say yes. It would be nice if they had capacity just to send it off in the normal fashion. They don't call us when they need to test for flu. They collect a flu swab and they send it to the lab and they test it. It would be nice to have that capacity. We're not there yet. I think the test kits are being prioritized to those areas that are currently experiencing outbreak, and that makes a lot of sense. When we have limited resources, we need to focus it in those areas that are being more affected right now. And again, this is the all government, all community response that China displayed, and it has been successful. We have to be willing to say, we understand you guys need it more than we do, but still let's work on increasing the capacity so that we can offer this more widely. DSHS is in the process of trying to obtain more capacity. They understand they're feeling the pressure from us and everyone else. And we have shared that those requests with our congressional delegation when we've had the opportunity to speak to them. I think everybody's aware and appropriate pressure is being applied.
That's great. Thank you.
Okay, Ann.
I had a follow-up question on the testing. And actually, it relates to seniors and places that you've mentioned that are at risk. So I think I heard you say that you all are working with those places like senior living centers, assisted living, and that sort of thing. So to provide guidance to them, if I heard you correctly. But I wanted to drill down for a minute. I'm wondering about the personal care workers. Many of those workers, they're dependent on their jobs, obviously, to get paid. And those are workers that, in addition to people that are actually hired or on staff at a assisted living center or a place like that. So I have two questions. One relates to what are the plans for testing of those workers? And at this point, you mentioned you're working with the Senior Commission. At this point, I would just suggest that we also think about the economic impact to those workers. So these are workers that are absolutely essential to the life and health of seniors as well as persons with people with disabilities. So I think that's an area that we really need to focus. So can you speak to that at all? Is that something y'all have addressed yet, or is it on your radar screen to address in the future? So there's two aspects of it.
Sure.
Their economic well-being and also keeping them well, particularly keeping them well for the folks that they're working with.
Yes, and so part of the directives that we're preparing with the law office will include mandatory reporting of workers or patients who become ill with an influenza-like illness.
Okay.
So that we can identify quickly if there could be a concern, and we can prioritize testing for people sick with ILIs in those facilities. Those should absolutely be at the top of our list of getting tested, so we can rule in or rule out a COVID-19 infection. We can put a lid on it as quickly as possible. So that is part of the planning process. When we receive calls about clinicians who are concerned about the possibility of COVID-19, and it involves someone who's over the age of 65, we're always asking, do they live at home or do they live in a facility? Mm-hmm. If they live in a facility, that's going to substantially increase our interest in getting that result quickly. So we are looking at that, and it is a priority for us. As we've seen in Washington State, there was a series of illnesses, a series of call-offs from health workers in that nursing home that went relatively undetected. So part of our planning now is also how are we as a health community going to support a facility like that if there is an outbreak and their staffing is low, to ensure that the quality of care doesn't suffer. And luckily we have lots and lots of nurses and physicians and EMS providers that are part of a disaster response plan for multiple different disasters that we can plug in situations like that if we know about it and can identify it early.
As far as the social service needs, we are considering everyone as we look through this. And basically, the bottom line is that our existing system, so through our neighborhood centers, we've had conversations with the county, through the county community centers as well, to be able to provide a certain level of financial assistance kind of on a case by case. So we are developing that as well. That was one of the slides that Dr. Escott included. That is the social service component of this as far as the response.
Well, I would just ask that as you reach out to the Senior Commission and also as you reach out to nursing homes, assisted living, independent living places, that you also reach out to the independent nonprofits or independent small businesses who actually, who the home health agencies. Not all of them are home health agencies. There's a lot of small, very small independent businesses who connect personal care workers with families. I'm sure you're aware of that. I would suggest that you include those folks in your conversations and work with them on what they might need.
Okay.
Greg.
Dr. Escott and Director Hayden and Mayor really appreciate all of the advice and work and leadership in the last few days, and the preparation for a surge, working on triage, working on really getting prepared and getting folks educated. I wanted to offer up just 3 places where I think that we can continue to step up and help. I echo the mayor's comments that if there needs to be a mid-year budget amendment, or if the manager needs to move emergency funds for us to especially be focusing on taking care of our seniors and those in a vulnerable position or those who are sick, that I, and I think probably the whole dais, I know the whole dais would be there to do whatever it is that needs to get done to make sure that we take care of folks locally. I think on the economic damage side, I really appreciate the philanthropic efforts, and if there are ways that the city can also go in and contribute with those who are hurting, not just because of the cancellation of events, but if there's longer term economic consequences, we should be prepared for that. I think, manager, if you start looking at ways that we could prepare to potentially accelerate some bond projects if there's more macro economic damage, and people, we have to be absolutely focused on the public health side, but then also if there's continued job loss or damage to the economy, we need to be thinking of ways to make sure that public funds are going in to make up for any lost jobs. And then a third thing is, the city of Dallas is now able to more aggressively educate and enforce their paid sick days ordinance, which is almost identical to ours. Unfortunately, Austin and San Antonio's are currently stalled in court. And so I would also ask that the governor and the attorney general and the Texas Public Policy Foundation pull down their lawsuit, at least temporarily, for us to begin to enforce our ordinance just like Dallas is able to right now, because this is exactly why we put this into place, so that people would not feel like they had to choose between a paycheck and being able to go to the doctor and get checked, especially people working in working class jobs in our assisted living facilities or in hospitals or as healthcare workers. We want you to be able to go and go to the doctor, and of course, it'd be great if employers would just go ahead and give them their sick time, but I think there's a call happening across the state for our state leaders to allow us to enforce those ordinances, because it really is a matter of life and death for a lot of people. And the U.S. Surgeon General, appointed by Donald Trump, just yesterday put out a call to say we need paid sick days for every person. And so I hope that that's something that will be under consideration. I also understand that the governor can activate by emergency measure more unemployment benefits for people, so that you don't have to jump through so many hoops to get your unemployment. And so I hope that he will consider that as well. But short of that, we need to do everything that we can as a city. And so whatever funding that needs to be made available to deal with the public health issues and those economic issues, I think that we all stand ready to do that, both because we might have to be canceling events, but also if there's longer term damage, especially focused on those places where there's folks who are more at risk of death.
Allison.
Thank you, Dr. Ascott and Director Hayden and Mr. Cronk, for your very evidence-based approach to securing public health and safety. So thank you. I had a couple questions first about our school-aged population, which I know is not the most at risk and so might not be the first out of the gate. But can you talk a little bit about how you're working with the school districts to make sure that our schools are safe and are not a breeding ground for the virus?
Yes, certainly. So the medical director for Austin ISD is part of our expert panel. So she has been continuously engaged in that discussion at that expert panel, and part of having her on there was to ensure that we had that group represented. We have Dr. David Lakey, who represents higher education as the Chief Medical Officer for the University of Texas system. So we have shared guidance from CDC regarding schools. We've circulated a screening tool for both screening staff and screening students for febrile illness, as well as some steps on what to do if somebody gets sick at school. Right now it's important for schools to start thinking about, what am I going to do if a teacher gets sick? It's similar to what was just discussed, in that there need to be no barriers. Teacher gets sick, they check their temperature, they have a fever, they have to go. School needs to be ready to fill in that gap. Nursing homes, hospitals, even bars and restaurants. We want there to be no barriers. If somebody is sick, particularly with a febrile illness, to them leaving work and going home and recovering. That is the linchpin in our public health response. It is the linchpin in our preparation activities. It is the number one defense that we have. So right now, it is absolutely critical that there are no barriers to people being able to stay home when they're sick. So we are part of the public health orders that we're working on is to address schools and how we can strengthen that messaging and strengthen the defense of school children. Now, luckily, so far, the evidence that we have from this outbreak is that individuals 18 years old and younger, number one, don't seem to have a very severe course, and number two, don't seem to be at least diagnosed with this very often. So in the up until mid-February, 18 and under represented about 2.5% of total cases. We're not sure why that is yet. Evidence is coming out every day to better inform us, but schools are absolutely on that list of priorities for how we're going to continue to protect the community. As we know from other public health interventions, if we share messages at school, hopefully that message also goes home, that engaged discussion can happen, and the family can be informed of the advice. So we are absolutely working on that.
So I have two high schoolers, and I would just say I think that there's still some messaging that needs to happen. I don't believe we've even received a message from the school district saying keep your kid at home if they're sick. I know we don't control the school district, but in your conversations, I think there's much more that could be done to communicate and to address those concerns. We're about to come on spring break. What is your recommendation for families that are trying to figure out whether they should proceed with their travel plans or not, especially if they involve air travel? Obviously, we're not encouraging air travel overseas, particularly to the targeted countries. But what is, as our medical director, what is the recommendation with respect to travel on airlines at this point in time?
I think it's important for families to pay attention to where there is person-to-person activity. There may be cases in locations that are travel-related. Those don't represent a substantial risk to individuals. It's really the locations where there's person-to-person spread, and maybe we don't know where that person was or who they may have infected. Those that don't have evidence right now are going to be safer. For those who are at higher risk, there really needs to be a conversation with their healthcare provider to determine if now's the time to travel on an airplane, particularly longer air trips. Driving in a car is going to be isolated. The only risk you're going to face is your family. But it really is something that is going to be based upon that individual's threat, either due to their age or underlying health conditions.
Thank you. I was struck last week, we had the press conference, I think it was on Tuesday, that there were comments that folks are going to come anyway, even if we cancel South by. So we have now canceled South by. There's still reports of folks coming. How are we addressing any potential health issues related to those additional folks coming to town?
So we're working with our public safety agencies to try to determine how many folks are still coming. Again, we're going to continue that community messaging. Part of our the public health orders that are in the process of being generated is posting of signs in restaurants and bars, and some other steps to help make sure that whoever comes, whether they're Austin residents, they're from other parts of Texas or other parts of the country, are seeing that message over and over and over again.
Thank you. And then my last question, I think, is for Mr. Cronk, and we spoke about this. Obviously, we made the decision to cancel South by Southwest on the basis of health and safety, but there will be large economic repercussions and potentially big impacts for our budget. So, as soon as we can, if we can get some detailed estimates so that we can take any steps that we need to take earlier in the budget year, I think that would be important. I would also be interested if there's information that can be shared for any consequences for the airport and the running of the airport as and other stuff that we need to be mindful of, just from a responsible government perspective for our budgeting and choices that we're making moving forward.
Councilmember, thanks for bringing that up. And as we go through budget deliberations, we'll bring those issues as we learn more about the impact of this on our community. And so absolutely, we'll be providing more information soon.
Great, thank you.
Thanks, Mayor. Thank you for making a very tough call this last week. I know it wasn't easy. And Mayor, thank you. There aren't a lot of powers that sit in the mayor's office separate from the council, but this is one of them. And thank you for making a very tough decision that no matter what you did, we're going to have impacts across the city and across the state. Quickly, where did the number 2,500 come from, and what do we think 30 days will accomplish?
So 2,500 is the benchmark for state law for mass gathering definition. Again, there's some element of risk for any large event for disease spread, but because that benchmark was there, because it's going to target the higher risk due to larger numbers of people, that seemed like a reasonable benchmark to set for focusing our attention.
Do we know roughly how many events that are planned beyond South by that cross that threshold?
As of yesterday, we were alerted there are 20 events that fall
Okay.
into that category.
So it's not like there are 1,000 events and APH doesn't have the resources to help people go through their plan. It's a fairly small number, and so it seems like those groups, if they do the right thing, can still move forward, and the staff has the resources they need to help folks do that.
Yes.
That's good.
Those two questions that you asked, there are also an additional 230 permitted events, non-sanctioned South by events, so it's also within the range of our staff dealing with, and they're dealing with those even though they're below 2,500. And your question on the 30 days limitation actually came from the person participating from the University of Texas who said when you issue a ruling like this or an order, don't leave it open-ended. Actually put a date on it so that you make sure that you go back to revisit them.
Great.
We don't know what's going to happen in 30 days.
Yeah, and I've been fielding questions on that. I'm interested in the airport conversation as well. It seems like a very unique situation contextually to the other questions that we're having. So what other information, or if there are FAA regulations that apply that we're not talking about right now. We don't have to do it right now, but I'm interested in that conversation. My office fielded a lot of calls starting the hour after the press conference. I spent more than a decade running the LGBT Chamber of Commerce and working in the small business community. Kate on my staff spent 20 years at the Chronicle, working in the music industry and all of the cultural arts side of the city. And so we started having meetings that night. Folks who were reaching out to my office wanting to know what the economic impact was going to be. And I feel like it's a good conversation to have now while there aren't cases, so we're not weirdly conflating a very challenging public health issue with economic issues. So this is an opportunity to talk about it. We were even at the art show at City Hall, closing my office door and having meetings with folks from the music industry while others were milling around my office looking at the art. I'm concerned that the conversation about Austinites going out to eat and choosing local businesses is not going to be sufficient, because we're talking about an event that generated $300 to $400 million of economic impact, and that's outside money. So we should shop local, we should eat local, we should drink local, but we should be doing that anyway. And I know in Austin we probably do that more than other cities, just as a baseline activity. So I want to be involved in a much deeper conversation about how we're continuing to engage all of the external industries that benefit from South by, the folks who didn't come here but whose businesses have been built by South by. I don't want to @ Jack at Twitter, but your business kind of launched from South by, and I think, were one of the first to say you weren't coming. So I hope to see a support line from Twitter to help the city and the community that launched you. Same thing applies to the music industry. I think there's a lot of opportunity to think bigger than just shopping local. There are going to be, as you said, larger economic impacts because of coronavirus generally. And if we had an even nominally functional federal government, I would feel more confident that maybe they could do something to help with those larger nationwide impacts and the way it's going to impact us here in Austin. I hold out hope that maybe 8 to 9 months from now we will have a functional federal government, but that's up to the voters. The opportunity for us to collaborate with the music industry, with the tech industry in this moment for the city, for the Economic Development Department, for the Small Business Resources staff, I think is unique. This is a really important conversation, not just for the folks that own the venues, but for the folks that work at the venues, for the folks that supply the venues. I have friends that have had venues close that they owned, small businesses, because their landlord wouldn't let them stay open through the next South by. And they closed a month later. There are venues now facing that conversation, folks I talked to over the last 3 days. And when I talked to one venue in particular, I asked them what were the other businesses they talked to that are going to see this really dramatic impact. And the first thing they said was, "Oh, the guy that delivers ice. How is he going to make it? I had this huge ice order." Of course, ice is pretty perishable, so it's a good question for the ice guy. Maybe less so for the alcohol guy when you can store the alcohol. But nonetheless, I think this is really important work. And whether or not it needs to be a resolution or if it needs to be some other effort, I think this is an opportunity to do something really special and something that can be beyond South by, something that can help folks who work in those venues feel more secure, not just during March, but year-round. Folks that, musicians who are looking for their gigs to pay a certain level, who are the busboys who are looking for health care in a more reliable way. This is a moment to do that work, and I want to be involved in that work. Spencer, I had some early conversations with Economic Development. I know they were doing some brainstorming, and I want the public to know that work is going on. But I want us to be thoughtful about how we can work in parallel to the public health crisis, that we're solving our economic issues at the same time.
Kathy, Councilmember Tovo.
Thanks. I have a few questions, but I'll just pick up there. I think that's really important, and I want to echo my colleague's suggestion. And so, perhaps that would be a great discussion for another work session. What ideas SMBR and others have had. I've gotten some suggestions over the last week from people that range from, activities the city could do, from waiving permit fees for pedicabs to other kinds of things that would be within the city's realm. So if you could, as your staff is able to come up with some of those suggestions that would require policy actions, that would be, I think, something that many of us have spoken to here today, figuring out how we might better mitigate that impact. I want to switch gears and just add my thanks. This is an extraordinary time for our city, and I just feel so appreciative of the expert staff, professional staff that we have leading this effort. So thank you. As my colleagues have said, you made some really challenging decisions, and I appreciate the thoughtfulness and the insight that you brought to those. And Mayor, thank you. I know this is has to have been a very challenging couple of weeks for you as well. So, can you talk a little bit about, and just before we move on, no, let me just move on. I think we've hit on that. Could you talk a little bit about, could you offer some suggestions to people? This is cedar season and oak season and other allergy season. Can you help members of our community understand what they should be looking for in terms of symptoms before they reach out to their physician?
So right now, the evidence that we have is the two primary symptoms are dry cough and fever. Those are not very distinguishing features of anything, which is why this is a diagnostic challenge, particularly since we still have flu season going on. This is what I was mentioning before about testing capacity. There are going to be a whole lot of people who meet those two criteria. Once because the travel number of countries with person-to-person spread is going up, that's going to be unreliable soon. So now we're just going to focus on people with those two things. I think the answer is stay home. And if you're young, don't worry about it too much. Stay home, do the things you would normally do. Chicken soup and Netflix would probably be fine. Keep up your fluids. If you're an older American, if you have heart disease, if you have lung disease, you need to have that communication with your physician. You need to call them or connect with them on telehealth. And certainly, if you get worse, you need to go to the hospital and get evaluated. Again, that advice is going to change as we hopefully identify a treatment regimen that will be effective for those who are infected. But now it's the same things we've always said. Take care of yourself, stay home, get rest, keep up on your fluids. If you get worse, then let us know.
But fever would be the distinguishing factor from general allergies.
Yes, yes. Allergies are going to be, watery eyes, runny nose, generally not the fever. Some folks will develop a fever with allergies just from inflammation. But, that's a key distinguisher generally between allergies and bacterial or viral infections.
And I know that you've had an opportunity in several of your public conversations to talk about the outreach you're doing among medical professionals. I just want to be sure that includes some of our emergency clinics, our walk-in clinics as well. I did have an opportunity this weekend to take some in my family to a couple of those for an injury, not anything else. But there were differing, in the one case they didn't ask questions about why we were coming in. In the other case they had no signage posted on the door about it. In one instance they did. So can you sort of assure us that outreach that you're doing is hitting our emergency clinics and our walk-in clinics, because many people in our community may not have a regular physician, and on the weekend their regular physician may not be available. So I want to be sure we're hitting those places where somebody who's feeling very ill might go first.
Yes, and we intentionally have a member on our expert panel from the freestanding emergency room and urgent care sector, so that we are thinking about that space.
Great.
And this is one of the things, we've sent out advisories to nursing homes and assisted living facilities. These are things you could consider. We're preparing, there's advice out there for hospitals and other healthcare settings. The challenge is what you just described. There's a lot of variability. Large nursing homes and assisted living facilities that have a large infrastructure to support this kind of thing are going to be well organized, whereas other ones may not. So by issuing these sets of orders, it's going to help us gain some uniformity in that messaging, the messaging regarding disease prevention, as well as the steps to take to try to further reinforce those facilities and make sure that we're all working from the same sheet of music.
Great, thank you. And I think I heard you say in one of your conversations last week that restaurants around town were getting the posters about hand washing.
We sent out a notice to the restaurant, anybody with a food permit. So Austin Public Health licenses all those entities. We sent out advisories last week regarding the posters. We're preparing a directive this week, which will mandate the display of those posters at entrances to the restaurants, bars, any place that serves food.
And is that something the school district is also a part of because of their food service? Or could we encourage?
I don't have my
could we
environmental
encourage
health.
The school district.
I believe
put up some
cafeterias
more
are
posters?
still part of that
Okay,
licensing and
great.
permitting process.
Yeah, I haven't seen any new posters up in the schools I've been visiting in, and just based on my observations of some of the groups I was in, we could do with a little more hand washing in those environments.
So it will be your schools, it will be your child care centers. So all of those places that we permit, even from a vending machine perspective, if there are perishable items in a vending machine, we regulate that as well. So we will be getting that information, even out to car dealerships that are just popping popcorn. So we're going to get that information out. So
That's
anyone that is doing anything with handling food, that information was disseminated. And then the next step would be is to move into those thorough conversations about posting those materials at those sites.
Thanks very much. And then I think my last question gets back to really one of the earliest points you raised here today, and that is about the events and the sizing of events. And that makes more sense to me. Thank you to my colleague who asked the question about how you came up with 2,500. But we continue to receive questions about why certain activities, if they're drawing people from, if they're not necessarily, well, two kinds of questions. One is about the larger scale activities, such as the rodeo, such as MotoGP, where you stand with relationship to those events, and then why some of those smaller events that might be drawing people from places outside of Texas are not covered within the cancellation.
So the department is having conversations with the rodeo staff. We actually have a tour out there today to be able to walk the facility and have conversations about mitigation. And so we are taking each of them on a case-by-case basis. As far as the event this past weekend at CODA, what we determined is because it was a larger outdoor venue, that there was the ability to mitigate that event, so that event could continue as scheduled. We did have our environmental health folks out there, and just continuing to work with the vendors and have that oversight. So we do have several of those on our radar, and we're going to get to them as quickly as possible.
Thank you. And then lastly, how are you communicating with the hospitality industry, including short-term rentals, about the need, any additional cleaning needs?
We're going to be working with our code department. Our code department is actually a part of this team that we have assembled to help us with the mass gatherings. As most of you may know, there is a current PACE team in place that the City of Austin has put together previously before this. But our environmental health team will have code officers working with us to be able to provide that information so we can disseminate that as well. One of the other really good things is that we have worked across in several departments where we've sent information to them specifically, and they have sent that out to their contacts as well. So it's really just widely disseminating information, throughout the city, and then going back to that kind of drill down once we have some orders in place.
Thank you very much.
Councilmember Harper Madison.
I think my inclination to wait and sort of see what everybody else said was accurate, because all my questions and concerns have been addressed with the exception of one. I haven't heard anybody talk about incarcerated people, and so I'm curious about what we're thinking there. And then the other thing I haven't heard in terms of precautions is these tiny, nasty, nasty computers that we walk around with all day. And so just those are 2 points of consideration I haven't heard mentioned yet.
So the as a part of the Emergency Operation Command Center, the city and the county have put together a team that are building services from both city and county. And so basically as a part of that, they're going to be coming up with some recommendations, and then we're going to share those with Dr. Escott as well, because what we understand is that, you know, we have to protect the people that are working there, but we also have to protect the people that are incarcerated as well. And so that group established yesterday and has begun those conversations. And so once we have the recommendations, we're going to get them to Dr. Escott and then make sure. The other thing that you're going to start to see is you're going to start to see more city facilities like our recreation centers, our libraries, most of our, you know, where we are really working directly with the public to have more signs up, because that's, I'm sure most people are thinking, why are y'all not putting signs on your city facilities? We are in the process of working on that as well with our building services department. And then lastly, we've had conversations with building services about cleaning and the number of times that they are cleaning on surfaces, ensuring that, you know, internally to the city and internally to the county, that we have established a cleaning protocol.
I guess the only other thing that wasn't addressed was I literally haven't heard any warnings about how filthy cell phones are, but I happen to have seen the data, and so I'm just wondering if that's something we can include in our ability to really have people be mindful about common behaviors that we just overlook.
Yes, and that's in, you know, we consider that as part of the washing your hands frequently and not touching your face, as well as the direction we've given about cleaning commonly touched surfaces frequently. As you have described, cell phones are disgusting. And that is something people need to think about, because they're constantly touching their phone and depositing all sorts of things on that phone. So it is a great advice, and we'll certainly incorporate that in the future to remind folks to clean it, wipe it frequently.
I appreciate that. Thank you.
Okay, Councilmember Ellis, then Councilmember Rodriguez.
I really appreciate all the work that has been going into this, so thank you. And I know Mayor and City Manager, these are tough decisions to have to navigate, and appreciate your diligence on it as well. I've heard a couple people mention kind of the distribution list. How are we getting the word out? Has there been any discussion of like a one-stop shop, like a subscription button that says you'll get notified anytime there's an update? 'Cause I know it seems like departments and you know, different community stakeholders have been communicating with you. We can give that information out through our offices as well, but I just thought maybe it would be helpful because there's so many different entities both in the city and from outside the city that may want to pay attention, and I thought it might be helpful to have kind of one spot where you can get a blast that says, go check the website for the most current updates.
We will have a conversation with our Homeland Emergency Management about that.
Okay, yeah,
Thank
I think
you.
that could be great because I'm getting things from constituents and school districts and businesses, and I thought that could be really helpful if that's easy to accomplish quickly.
Councilmember Rodriguez.
Thank you, Mayor. And I also want to thank y'all for all the work y'all been doing. My question is, how are y'all handling the front line, the airport workers that are out there, and also the airline workers? My understanding is that because we can't control their labor contract, they also don't have sick leave. Is that? Have you looked into that?
We've had a couple of conversations with the airport management staff there. it is very important that they have to follow their federal guidelines, but we are overlaying that with kind of local, our local guidelines. But we will take this into consideration and make sure that we are expanding those conversations with the airport.
Yeah, 'cause I'm really concerned that we have workers out there that don't have sick leave, and they're right there being exposed, handling all the luggage and everything else that comes in and leaves, and that's a really concern to me that you know, we have a federal government that doesn't regulate their employees, the airlines employees, where it guarantees them sick leave. So I'm very concerned about that.
Councilmember, we have had discussions regarding how to further protect those individuals. This goes back to measles and rubella, and the mumps, and now this thing, because we do recognize that there are many folks who are not City of Austin employees that support the efforts of the city, and we do want to ensure that as much as possible we can support and protect those individuals. So I think there's going to be an ongoing conversation. We'll certainly make sure that the messaging regarding the hand washing and the staying home when you're sick is getting to those individuals. But I think that's a great suggestion and a great observation.
Well, thank you, because I sure hope so, because they're the ones that are really in the front line, and it's really concerning that we do have our airport's an international airport now, and we are getting a lot of people from out of country. I don't know if that's I know that now we're not allowing some of them, but we never know how the other way around, where people can visit one state, other countries, and then come back to Austin. So,
just want to mention real fast. The first one is that I see that the Moto Grand Prix event scheduled for the first week in April has now been postponed until November. They had called me this morning. They wanted to make sure that we knew why. It's an international event. They were dealing with international logistics. They had the opportunity to be able to postpone it till November, so that worked really well. Again, I would add as an aside, it's not just because it's a big event. We're still having big events that are moving forward. They just need, at this point in time, to go through the mitigation steps. But this international event, able to be postponed till November, seems appropriate, so good to see that. I would also mention that Workforce Solutions, which is the entity in our city that takes point and lead on workforce development, working with folks that have been laid off or may be laid off, is issuing an announcement later this morning or this afternoon. They're stepping up and want to reaching out to South by. But anybody in this city that looks like they may lose a job or lose an opportunity, please reach out to Workforce Solutions. Any employer that's thinking they may lay off people, please reach out to Workforce Solutions. They have programs sometimes to be able to avert the actual layoff of workers. So I urge everybody to reach out either as an employer or as an employee. And their website is WFSCapitalArea.com. That's Workforce Solutions, or it goes by the initials WFSCapitalArea.com. People should reach out to them. Councilmember Kassar.
Dr. Escott, during the course of your answering another question, you mentioned tangentially that it was like the linchpin of the strategy for people to be able to stay home from work. Can you, just so that I don't put words in your mouth, can you just clearly lay out for us, as far as people being able to take time off from work, how important that is?
The ability to take off time from work is really absolutely critical at this stage. I think this is one of the reasons why this mayor and this council passed this ordinance last year, because we understand the importance of people being able to go home and recover. In situations like this, where we are trying to aggressively manage the potential for uncontrolled outbreak, this is absolutely critical. I'll tell you, I was on the phone with Congressman Doggett's office last week and had the same conversation with him, that my opinion at this stage, this needs to be federal law. We have to have the ability for people to stay home when they're sick, to ensure that they can recover appropriately, and that we can mitigate the risk to other people. I think it's absolutely critical.
Thank you. And so, again, given especially the risk for home health care workers and for seniors, I hope we ask our employers to step up and do paid sick days if they aren't doing it already, and then, again, ask the Attorney General to drop the lawsuit at least temporarily so that we can put it into effect. So thank you.
Councilor Tovo.
Yeah, I just wanted to mention that KUT and Culture Map have both published lists of other ways that community members can help out. And also there's an event that I was notified about today called Rally Austin on Monday. That is another way to kind of bring people together to talk about ways to assist. So if members of the community are interested in looking, those are a couple places to start.
Manager.
I just want to take a minute to thank this body. The leadership and support of the mayor and the council is critical for us to be able to address this challenge as a community. As you've seen, there's been unprecedented amount of cooperation and coordination, not only among city departments, but with our key partners, the university, our education systems, the county, and the support that we're getting from this body is so important for us to continue to address this as a community. So thanks to each of you for your leadership and guidance in that effort.
All right, Council, thank you very much. Keep us abreast, please.